Hi, I'm Sarah from Woodborough House. We're really delighted that you've decided to whiten your teeth with us here at Woodborough House. Just so you know, there are two types of whitening. One is home whitening, we call it, and I'm going to show you how to do that. The other is in-office whitening, which involves an extra step to the home whitening. You'll still be doing the home whitening, but you have an extra step in the surgery where we whiten your teeth with a stronger medical grade bleach. So for home whitening, it's really important to note a few things. It's completely safe to whiten your teeth, it won't harm them. Everything we use is CE marked and approved. It can be very sensitive when you whiten your teeth. Some people find it more sensitive than others. Sometimes it's your teeth that are sensitive, sometimes it's your gums. They can feel a little bit irritated. Don't worry about either because the procedure is completely safe, as I say, and it won't damage your teeth or your gums in any way. If your gums are a bit sensitive, that's normal. Actually, whitening your teeth can be really good for your gum health, so it's not a bad thing. With your teeth, if you're finding it very sensitive, take some painkillers and give us a call. There are 2 strengths of bleach or whitening gel, so if you're on the higher one, we may put you onto the lower dose. So what I'm going to talk to you about today is just the home whitening. There are various brands, so I'm not advertising one in particular because the procedure will be the same. Now you'll have had some digital scan done of your teeth, so either an impression with impression material in your mouth, or sometimes we digitally scan your teeth, and the laboratory will make you some little trays. You'll get them in a plastic container like this. It's really important that you keep them safe because dogs do like to chew these, so make sure you keep them safe and away from any pets at home. And usually you'll be doing top and bottom, because if you're doing top and bottom whitening, then obviously your teeth are all the same colour. So the trays are very comfortable to wear. We usually say you should wear them at night time. If you really are struggling, you can wear them in the daytime for a few hours, but the most important time is contact time with the bleach or the whitening gel. It is better to do consecutive nights, so even if it's a little bit sensitive, please try and push on and keep doing it unless you're really struggling, because the longer you have the gel on your tooth surface, the quicker and more effectively your teeth will become white. So I'm just going to show you in the top tray because it's bigger like this. What we want you to do, we usually give you 2, sometimes 4 syringes depending on the size of the syringe. We do recommend you keep the gel in the fridge. Like a lot of medicines, if you keep them in the fridge, they'll just last longer, particularly through the summer months. But the tube you are using, I would recommend you take out so it's more room temperature, because your teeth can become sensitive if you put a very cold fridge temperature gel into your mouth. The end of the tube will have a little nib on it, so you want to remove that, just break it off, it's sealed, and then it's perfectly safe. Bleach in itself is intrinsically obviously a sterile substance, so there's no problem with cross-contamination. Then if you hold your tray like a little horseshoe, what you want to do, the gel is very viscous, so if I show you here and I push it, you'll see it's not going to run very far. It's quite gloopy and it will stay on the end of the syringe. And it's not about putting a whole lot of gel into the tray. Obviously, Archimedes' principle, if you fill up every tooth with gel and you put that in, you're going to displace it with your teeth. It's all going to ooze out, and that can cause gum irritation. So you only need a small amount. What I normally recommend is about the size of a plastic sewing pin head. So that's about how much I would recommend you put in. And you want to put it in around the outside arch of your tray, whether it's top or bottom. They both look the same, so always go for the outside. And you want to put a little bit of gel, if I show you here, just a little bit of gel, about as much as that plastic pin head on the outside, and then just wipe it off. So you want to do that around each of your teeth. Your dentist may have told you not to whiten porcelain crowns or veneers, so please follow their instructions. This is just because you can't change the colour of a crown or a veneer, or a bonded tooth, which is bonded with composite filling material. So your dentist may tell you that, and they might just put a little cross or do you a diagram so you know which teeth not to do, but obviously that's an individual. Then you want to go around each of the teeth, putting the same amount all the way in on the outside of the horseshoe, all the way around. Keep your syringe safe somewhere, keep this one at room temperature, and then you want to pop the tray into your mouth. I'm not going to do it, but you want to pop the tray into your mouth. When you've done that, if there's too much oozing of the gel, that means next time put less in. If there is, you can just use a little cotton tip just to clean away any excess away from your gum, or a tissue, or you can just wipe with your finger. Pop that in, it seats very nicely, it fits very nicely, and then ideally sleep overnight with it in. You may find the first couple of nights you're doing this, you may have taken the trays out in your sleep without knowing. That's normal because it's something new in your mouth, don't worry about that. But just make sure the next night you're putting it in again. In the morning, when you wake up, take your tray out. One thing you may notice, if you have teeth that are a little bit flocked in colour, the white bits will become whiter than the surrounding tooth tissue. So they can look a little bit cloudy. That happened to me. Don't worry, the other bits of the teeth will catch up, but you may need to whiten for a few more nights until they catch up. This cloudiness or flocking will look more obvious first thing when you take these out because your teeth are dehydrated after the bleaching. Some people find that a bit alarming, but we can reassure you that will all even out as you continue whitening. So take the tray out, give it a little rinse under the tap. You can use a mouthwash or something if you want to clean it, but really, as I say, bleach itself is intrinsically very sterile, so you don't really need to worry too much. Then pop this back into your tray and keep them nicely stored during the day so they're safe until the next night. It's really important that you do try and bleach on consecutive nights because, as I say, once you've got that amount of bleach working on your teeth, it's going to be far more effective if you do it night after night. If it is sensitive to hot and cold things afterwards, try to avoid really hot or really cold food. And same with brushing your teeth. You may find it's a bit sensitive. Just use water that's tepid, take some painkillers, and if you are concerned about anything, please give us a call.